It's just gone 13 minutes after 6 here on the South African Morning. Good morning to you if you've just joined us. Now, an update on the cholera crisis. At least 43 people have died from the cholera outbreak. Now, the health department says these numbers include confirmed and suspected cases. There are currently 197 confirmed cases of the waterborne disease in the country. And the department, however, says it's pleased with the advanced achievement in addressing the transmission of cholera and reducing the mortality rate. We're joined now by Dr. Sibongiseni Dhlomo, Deputy Minister of Health. Dr. Dhlomo, good morning to you and thank you so much for joining us. The advancement are very little. It's cold comfort to those who lost loved ones due to what many are saying is a preventable disease.
Good morning, Cindy, and good morning to the eNCA viewers. You are correct. For that one, when a family, Dhlomo family, is a severe loss of 100% for them, we are looking into the aggregate data in our country, and we are hopeful that as we are releasing this information to you and to our viewers, it probably be the last that we are releasing on the outbreak of cholera over the past few months, because over the past few weeks, numbers of admissions and suspected cases of cholera have significantly reduced in our facilities. We have even closed down that hospital we used to call a field hospital in Panana. Yes, you are correct with the figures that we have quoted, but we are still hopeful because of the five provinces that we had this sort of outbreak is mainly Free State and Gauteng. The cases that you saw in Mpumalanga, Limpopo and Northwest were all travelers who had moved from Hammanskraal, the Kanana area. And you are correct, the breakdown again of the 43 deaths is 35 are from Gauteng. So what we are raising as a message for South Africa that please let us improve on our personal hygiene. If I am going to be really preparing meals or just coming in from a bathroom, let us wash hands so that even if I'm a cholera carrier, I may not spread it to other citizens. We do
yes,
know now.
Dr. Dhlomo, but also in terms of the basic hygiene, that's one, maybe we're dealing with the symptoms of a perennial problem. We know in Hammanskraal that this water situation had been there for almost 30 years. So it's one thing to say to people, practice basic personal hygiene when you don't even have the basic resources, i.e. clean, drinkable water. How then do you try and convey that message?
We were also amazed, Cindy, when we went in that space and we found a message coming in from the city of Tshwane saying, do not drink water from our from the piped water that we are sending you. We think it is not safe, and that is not been we are right, is a problem that has been there for some time. Hence, we think the working together of the city of Tshwane with the Department of Ubaba Senzo Mchun of Water and Sanitation has really yielded some progress in terms of this, because yes, we are on the side of health picking up those who are already affected and infected, and then we treat them, but you need to nip the source and really make sure that you deal with it. While that is happening, we are still therefore appealing to our citizens to keep on practicing that personal hygiene. But I can stay with you, Cindy, in the same household with cholera and you don't have, as long as I clean my hands, and also maybe we put a jig in our water, and I do come from the bathroom and not miss washing hands. If I'm going to be touching food for the household, then that would be great, especially because we now have some evidence that a significant number of those who have been actually confirmed, who have passed on, and those who are suspected have been into some social gatherings in and around Hammanskraal, whether a funeral or whatever gathering, and therefore somebody could have been just one source. It could have just been me, who is a cholera carrier, and I prepared the food without really washing my hands, and therefore it spreads to many more other people within that social gathering.
Yes, and can you just very briefly confirm if there are any class action or litigation, because the Professional Health Forum was of the view that this should not have happened. In other words, government, particularly the health department, is liable for the cases of cholera and therefore would bring a legitimate lawsuit for those who are affected.
If you do understand epidemiology and the pathophysiology of cholera, you would not think that Department of Health will then be put into that space. I don't know what would be the basis of that. We are also on the receiving end. We would want citizens to receive clean and safe water that does not come from the Department of Health. What we are dealing with is to treat those who have been infected and affected by drinking or eating unsafe, contaminated water or food. So that is not a process that comes from our side. The inspections and also making sure that the water is pure and safe comes from another sister department and other municipalities actually that give water to citizens in any part of the world. And therefore, I would not understand the reasoning of a lawsuit against the Department of Health, which has been on the receiving end in terms of also looking after the citizens who are infected and affected.
Clearly understood, Dr. Dhlomo, of course, saying that essentially this is the responsibility of the municipalities, the water and sanitation, in providing what is constitutionally a basic right of having clean and drinkable water. So that's Dr. Sibongiseni Dhlomo, Deputy Minister of Health.